Do these two supplements actually work together for losing weight? Let's look at what the evidence actually says. Inositol and berberine are getting a lot of attention right now, and it's easy to see why. People are looking for natural ways to support their metabolic health, and both compounds do have genuine research behind them. But there are some important things you need to know before considering either one. So what are they? Inositol is a naturally occurring carbohydrate your body produces and that you get from foods like fruits, beans, grains, and nuts. You might see it called vitamin B8, though technically it isn't an essential vitamin. The form most studied in research is myo-inositol, and most of the clinical evidence focuses on polycystic ovary syndrome, PCOS, where it may help improve insulin sensitivity and certain metabolic markers. Berberine is quite different. It's a plant-derived compound extracted from plants like barberry and golden seal, with a long history in traditional Chinese and Ayurvedic medicine. Its proposed mechanism involves activating an enzyme called AMPK, which helps regulate how your body manages energy, glucose, and fat metabolism. Research has looked at berberine in the context of blood glucose control and lipid profiles, particularly in people with metabolic syndrome. Both compounds have individual evidence behind them, but here's where it's important to be honest with you. The evidence for using them together specifically for weight loss is quite limited. Most studies have looked at each supplement on its own, not in combination. We simply don't yet have strong clinical data on how they interact when taken together. It's also worth knowing that neither inositol nor berberine is licensed by the MHRA for weight management. They're sold as food supplements in the UK, which means they're not subject to the same rigorous quality controls as licensed medicines, so the quality and concentration can vary considerably between brands. It's worth discussing product quality and suitability with a pharmacist before buying anything. NICE guidelines for weight management focus on lifestyle changes and, where appropriate, licensed medications rather than food supplements. So these compounds sit outside standard NHS treatment pathways. Now, safety. Both supplements can cause gastrointestinal side effects, nausea, bloating, and digestive discomfort. If you experience persistent symptoms, stop taking them and seek advice. Berberine in particular has the potential to interact with a range of medicines, including some diabetes medications, certain statins, anticoagulants, and other drugs processed by liver enzymes called CYP enzymes. So if you're on any regular prescription medication, please speak to your doctor or pharmacist before starting berberine. It's also important to know that both inositol and berberine should be avoided during pregnancy and breastfeeding unless specifically recommended by a healthcare professional. If you're thinking about discussing these supplements with your doctor, a few things are worth raising. If you have PCOS, ask specifically about the evidence for myo-inositol in that context. That's where the research is most developed. If you have concerns about blood glucose or metabolic health, ask whether these supplements are appropriate alongside any existing treatment. And if you have any chronic health condition or take prescribed medicines, medical supervision is essential before starting either supplement. To recap, inositol and berberine are naturally occurring compounds with some individual evidence for modest metabolic effects, but the research on using them together for weight loss is limited. Neither is licensed for weight management in the UK, both carry potential side effects and interaction risks, and neither should be used in pregnancy or breastfeeding without medical advice. Always speak to a healthcare professional before starting either supplement. This video is for information only and is not a substitute for personalised medical advice. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you want more evidence-based health content, give this video a like and subscribe to the Bolt Pharmacy channel. We'll see you in the next one.